I'm Marty Stempniak, staff writer for Hospitals and Health Networks magazine, with your preview of the November issue. First up, the November cover story is the last installment in Hayden Bush's three-part series looking at the high utilizers of healthcare services, a series we've dubbed Healthcare's Costliest 1%.
So this month is the final piece in my three-part series looking at high utilizers of care and some of the provider and community efforts to treat them better but also reduce costs. So we focus in on how those populations are impacting Medicare and Medicaid expenses. Take a look at some of the innovative experiments in the states ranging from Oregon to Indiana to Mississippi. We also focus on some of the efforts around dually eligible beneficiaries who are both Medicare and Medicaid, where some programs have seen some pretty substantial gains in cost reduction and quality improvement. And then finally, we look at how some of the issues around end-of-life care impact this issue and some of the ways that adhering better to patient preferences can impact overall costs for this population. So this wraps up a three-part series, again, where we've looked at hospital efforts to provide better care, community efforts to improve care for this population, and then finally looking at the government's role in terms of better caring for this population while addressing the major financial issues that are impacting the entire system.
Next, managing editor Bill Santamore discusses the trend of hospitals hiring chief experience officers. This is the final part of our year-long look at how hospital C-suites are evolving to meet the demands of a new healthcare environment.
In November, we're running the final installment in our year-long series called Focus on the C-Suite. And so far, the series has looked at established leadership titles such as the CIO, the CNO, the CMO, et cetera, and how their roles are changing in the face of healthcare reform and the transformation of the healthcare system. For instance, they're not limited to the silos that they've always been working in. A CIO, for instance, told us that she no longer just has to worry about implementing a new technology system, but she has to look at how IT affects the clinical side of the operation. So she has to understand better the clinical issues involved. We're looking at a title that's just now starting to emerge in hospitals around the country called the Chief Experience Officer. We talked to 5 Chief Experience Officers at 5 different hospitals and try to understand why this is an important and emerging title. And one of the reasons is, of course, the obvious reason is HCAHPS and the need to improve patient experience scores in order to get reimbursed under healthcare reform. But there are also other reasons. One is with the coming of ACOs, accountable care organizations, patient loyalty is a very important goal for hospitals. The CXOs we talk about say that their roles include coaching employees and medical staff about providing better patient experiences. They give them tools to improve the patient experiences in their hospitals. And they also, one of the crucial elements of their jobs now is to make sure the staff have good experiences. So they provide staff healing, they teach them how to be compassionate, they try to avoid burnout and turnover.
There are 2 other articles that I'd like to highlight. One examines the trend of physicians forming ACOs and what that may mean for hospitals. And in our interview this month, Suzanne DeBlanco, head of Catalyst for Payment Reform, explains how large payers are beginning to adopt value-based purchasing. That's a look at the November issue. For H&HN, I'm Marty Stempniak. Thanks for watching and have a happy Thanksgiving.